Hi, I'm Dr. Kez, Doctor of Chiropractic, and we are here to show you how to do vacuum cupping along the spine. One of the most common places for cupping to be done on patients, even in my clinical practice, is along this area of the spine to be able to break up adhesions where one muscle is being stuck to another muscle and causing that really stiff movement that we get, or up higher where the ribs are actually sticking to the muscles, and we want to break down those adhesions so that they can nice and easily glide over the top of each other. So there's a couple of things that you need to get prepared with your cupping set to make this a really easy process. We love that we've designed this so that the cupping sets are sitting up, makes it a lot easier for you to be able to grab what you need rather than having them stacked on top of each other, so it's much better. I have prepared the cups that I know that I need to do this cupping set for Em, but when you start out, you just need to get a bit of a guide by putting the cup over the area to get an idea on which size cup that you want to use. It is important when doing the spine to make sure you're not over the top of the shoulder blade. That's not the aim of what we're trying to achieve here. We want to be between the spine and the shoulder blade up here in the thoracic spine, not on the spine and not on the shoulder blade. So you need to choose a cup size that is appropriate to make sure that you're not too big and you're covering over on the spine. So that's important. I have today placed the magnet tips on my cups here, so it makes it easier for me to know which ones to grab because I've prepared them. You can use the Restore massage oil to put all the way up the spine. Everybody likes a bit of a rub before they have their cupping set. Or you can just pop it onto a finger and rub it over the top of the cups that you will be using. It's important to have oil between the cup and the skin. It allows it to nice and easily draw the skin up with a bit of lubrication instead of sort of dragging it over dry skin, so that's important as well. So I've chosen the cups that I want, just to let you know with your cupping set here, the ones that have got the angles on them are not necessarily to be used on the spine. It's much easier to use those on joints. We'll show you that in other videos. So the nice and smooth set are the sets that you're wanting. You're wanting a larger size for the lower back so that more of the muscle can be drawn in. It's a bigger area with more muscle. Smaller size, I like to start right the way up the top on that. The levator scap muscle, which gets very tight on a lot of people, especially those that are spending time typing at a computer or what have you. These are really fantastic, nice and smooth. And like I said, some smaller ones in through between the shoulder blade and the spine to make sure that you're just getting the skin and the muscles rather than getting on top of those bones. Nice and simple. So I'm going to start off with, poor Em doesn't get a massage today, just a little bit of a dribble on a finger. I like to rub it on both of my fingers and then go around to the set of the cups that I've decided I'm going to use. Rub it over the top of those cups so that you know that they've got a little bit of oil on top of them. Grab a hold of your pump. We've mentioned this before with the beginning of your set. Make sure, and I did this once when I put my magnets on, make sure that all of your cups are primed, that the little yellow valve has been pulled out. When you first get the set, the manufacturer makes sure the seal is tight, and so you need to pop that out to begin with. Once you've done it once, you won't have an issue with needing to do it again, but I'm just letting you know, if you get to the point that you've popped your pump on and you're applying pressure and you're not hearing that sound, it's because that little valve in there needs to be released first. Okay, I start at the top and I work my way down. Just remember, these have already been oiled, okay? So I haven't oiled Em's skin, but I'm going to do it on the cups instead, which I've already done. You don't need to use a huge amount of pressure. This is a nice new set, so they're nice and stiff to begin with. But just enough to draw the skin and the muscle up towards the magnet. So in this case, the skin is going to be touching the magnets. You just have to make sure that you don't miss any of the skin. If you're going to draw up and it keeps releasing, it's because there's a gap and air between the skin and the cup. It's important to make sure that you don't allow that to happen. When you first use these cups, the knob's very stiff. You can actually run your finger with the oil in to make it easy to pop the cups off. And you don't have to push it all the way down to do it, but I find if you put just a tiny touch of oil in there, it works really well and it's nice and easy to draw back up again. This spot in here for a lot of people is actually quite tender, and I find in clinical practice that's where people kind of go, oh yeah, that's really sore. It's a really common spot to hold tension, so it's important to make sure that we release that tension with these cups. As the shoulder blade here starts to taper around, we can use a slightly larger cup because we're not going to be on the actual shoulder blade. And you'll see probably from there that you can see there's a little gap where the spine runs. We're not putting the cup directly on the spine. Super important. Some of these I'm giving a little bit more than the first pull, just because I can see how much skin and muscle is being drawn up into the cup. But don't apply too much pressure. You don't want the person on the table going, that's too uncomfortable, I can't handle it. You do a little bit this time, and then if you feel like that was easy, you can do a little bit more next time. But when you're doing it for someone else, it is important to get their gauge on how they're feeling. Everybody's got a different pain tolerance. And the beauty of having your own cupping set at home is you can do it as often as you like. You don't have to do it gung-ho first time to get the best result in the world and never have to do it again. You can just do a little bit today, and do a little bit in a couple of days. It's all good. How you travelling down there, Bo?
Excellent.
Just making sure you haven't fallen asleep. When you first put the cups on, they are quite tight. So you will feel that, oh yeah, okay, that's really quite tight. And that's because the two muscles are still stuck to each other. So as you've drawn that top layer of skin and muscle into the cup, you will find that this other muscle is being pulled as well. Over about a minute, that's usually about the time it takes, you'll feel like it's released. You'll feel like the pressure's released a little bit, and that's because the adhesions have started to break down, which is exactly the purpose of what we're doing. Keep in mind, one of the massive added bonuses of doing cupping as well is that you can also increase the circulation in the area. So not just that biomechanical change of being able to change the muscle sticking and adhering to one another, but also that you are actually increasing the blood flow to the area, which you can tell by the colour of the skin that's been drawn up into the cup. It becomes quite red in colour, rich in blood flow, which is awesome. As a result of that, it is also detoxifying your body, which is great because, you know, none of us are that healthy these days. Someone like Em is, but, you know, the rest of us normal people probably not quite as healthy as Em is.
I try my best.
All right, so once the cups are all on, that's when I usually start taking my time. I look at it and go, okay, it's going to be about 10 minutes from this point. You don't need to do anything else other than observe and get feedback from what's happening with your patient that's on the table. Watching the colour, if any of these cups turn deeply purple quickly, you can release the pressure of that cup or take that cup off. It's just that that area was obviously very, very sensitive and it's created a reaction really quickly, and it's okay then to go back and do that again the next time that you do it as well. So what we don't want is for any areas to become really uncomfortable. So it is important just to keep your eye on what's happening. Generally speaking, once you've finished, clearly put that one on properly, once you've finished, you will find that some areas of the cups will be deeper in colour than others. There's even a phenomenon where in one cup you'll find that there'll be an area of the cup or the circle where the cup was on where it is deeper in colour than others. The areas where you've got that deeper cupping kiss response, they are the areas that have had stagnant blood. There hasn't been enough blood flow in that area. So those areas really needed the cupping, super important. Let me just grab that cup. Sometimes up in the top here, we can end up with a little bit of air in the cup. When air gets into the cup, they sneaky release on you, which is a bit of pain. But you can always go back and do it. Also, if you find that someone says, oh yeah, no, that's a bit tight, but then they feel like you want to add a little bit of extra pressure, you can do that throughout this. So it might go, oh geez, my lower back feels like it could do with a bit more. You can pop it on and draw a little bit more air out.
Yeah, my other shoulder one.
Other shoulder one, you want more tight?
Yes, please.
This is a common area to be super tight on all of us. Why is it that we all stress out? Oh, I've released it. Why is it that we all seem to stress out and hold tension in this area up here? We're all the same, I guess. But that's a really common area. It's actually funny because generally speaking, we tend to have an area that we hold tension. It can be up and around our shoulders, which often triggers off headache, sadly. It can be the middle back, or it can be the lower back. Everybody's slightly different, I guess. So some people find that they end up with lots of lower back aches. Other people find out they end up with more neck and shoulder issues. It just depends on, I guess, our occupation and what we do with our body on a regular basis. The other thing to observe for when you're looking at the cups and the colour of the cups is to see if any slight blistering occurs or any bleeding. If there's a blemish on your back, like a little pimple or something like that, when you draw the pressure of the cup like up and into the skin up and into the cup, you will find anywhere that has broken skin might actually start to bleed. If you've got skin tags or if you've got cuts like a pimple or whatever, try and avoid those areas if you can. But if you've got an inadvertent spot that you didn't know about, you will find over time that it will start to bleed into the cup. You can release it, clean that off, and then pop it in an area slightly off to the side that doesn't have that blemish in it. It's not going to cause you great detriment, but we certainly wouldn't be encouraging you to be going over skin tags and moles and causing irritation like that if you can possibly avoid it. How are they feeling, babe?
Amazing, I love it.
Good, good, good. So we have chosen to put the magnets on. You don't have to. There's 5 different ways that you can use our premium cupping set. One of them is just to have the cups on their own, wherever that may be. Your lower back is just one place that you can do this. You can deal with frozen shoulder, tennis elbow, dodgy knees, anything. Plantar fasciitis, you name it, you can treat it with the cups. This is just one example of how you can use the cups. Probably the most predominant thing that I do in clinical practice is releasing that spine. Keep in mind, chiros are all about adjusting the spine and make sure the nervous system is functioning properly. So once these cups are on and you've done your treatment, you then take them off after 10 minutes and you can wipe down the oil that's on there and you can put the Chirofix on afterwards to be able to help with that release of the stagnant blood that's been flowing through there, the inflammation that has been created. With the magnets, it's the same form of therapy, but the magnets are actually enhancing the treatment by increasing the iron from the blood or encouraging the iron from the blood to be drawn towards the magnet, which then even further increases circulation in the area. You can do slide cupping, which you would do with just one cup. So imagine these cups aren't here. We'd put a very light amount of pressure on a cup. Make sure there's plenty of oil. This is where you would actually squirt the oil on the body. Make sure there's plenty of oil so that there's just enough for the suction of the cup to hold. And then you draw the cup back and forth on the skin and it maintains suction. Every now and again you'll go over a little bit that'll pop and you just apply a little bit more pressure and slide it. But it is important. If you go to move the cup and you can't move it, there's too much suction, so you need to just release a little bit by pulling the little valve to allow a little bit of air to escape and then slide that. That is a brilliant way to increase the blood circulation over an area that's causing you grief. We've often spoken about Em having rib issues. It's a great way to help deal with a rib issue is to get that slide cupping happening right over the top of that area of ribs that are causing discomfort. It works really, really well. So really good therapy that is. The other option too is like a release cupping, which often people do on the face. They don't want to have big little circle thingies happening on their face. So you can use the pump to draw the skin and the lower muscles in to the cup and then release it. So pull the valve and take the cup off. Then use the trigger pump to do the same thing again, draw it in and then release it again. And you can do that multiple times to get a similar effect to what you would get as if you pumped it and left it there for a period of time, but you don't have the tendency to get that blood pooling into that sort of cupping kiss that we refer to all the time. So that's another way that you can use it. And the little cute cups that are found underneath the pump handle, these little tiny cups are actually really good at stimulating acupressure points. So Em and I have done quite a few videos on acupressure points to help with various things. It might be to rid you of headaches, balance your hormones, any of those types of things, get rid of nausea, whatever the case may be. And you place them on your body and then allow them to just sit there so that they are stimulating, increasing the blood flow to that acupressure point to stimulate that acupressure point. So that's the other way that you can use these cups. So nice and versatile. And like we said, you can treat way more than just your lower back and your whole back, actually. If you've got someone else to do these cups for you, it is absolutely ideal because you get the opportunity to completely remain neutral. By neutral, I mean nice and flat and comfortable. You're not twisting to try and put the cups on. But I've actually left my extension cord over there. I'll go and grab it in a sec. But you can actually put an extension cord on here and actually do some of the spots that are a little bit hard to get to. You can imagine if I was trying to put a cup on here, I wouldn't be able to get the right angle of my arm because I'm just not flexible enough to be able to do that. So I'll show you what we can do to fix that. I was playing with mine before, so I'll go and grab it.
I'm not asleep, I promise.
I thought she was there for a second.
Nearly.
All right, so here we have an extension tube. It has a small end and a larger end. The small end goes into your pump. Again, make sure you've got nice and lubricated in there. Makes it just easier to pop off. I find the same thing with the inside of this one. And then you can use this in areas that you would otherwise not be able to get to. Sorry, mine's all twisted. I was busy trying to put it in places I shouldn't have before, just saying. So you can then apply the pressure there and take the little knob off so that the cup can remain in that position so that you can do it on yourself. And then you just need to, I'll show you how to take these off in a minute, but once you've done, sit there for watching Netflix or whatever you're doing for your 10 minutes, then you can release that cup. But this gives you the ability to do some places on your own that you would otherwise find a bit challenging to get your arm into the position of being able to do. But ideally, if you've got a loving partner that's happy to do the cups for you, I think laying down and relaxing while you're having the treatment done, even if it's a knee or an elbow, it is much better from a healing perspective to be able to remain nice and neutral and allow that healing to take place. All right? So, how are we travelling there, baby?
Awesome. So relaxed.
Now, my wipes are actually behind the camera, but normally when I am doing any treatments, we use the disinfectant wipes to wipe the rim of the cup before we put it back into your set. We have designed the foam so that the cups sit upright. I find that so much easier than having them all sort of thrown in together. Gives you a good visual of which cup to pick. You can easily see when you're looking down, it's probably a bit hard on the camera, you can easily see which one has the curves which are designed for sort of areas like an elbow that are a bit rounded in shape compared to the flat ones which I find easy to put on a thigh or put down through the back or what have you. So I just find it a much easier visual and quicker and easier to do, but it is important to clean the oil off when you go and pop these cups back into your set. So I'm going to leave that one aside because I haven't cleaned it up. Well, baby, I reckon the bottom left one needs a bit more pressure. How's that one feeling? You feel all right?
Yep, feels good.
I'm going to just tighten it up a tiny bit. Is that okay?
Yeah, go for it.
And the reason I'm saying that is I can see that skin it's not quite touching the magnet at the moment. Not saying that it always has to, but I can just see that it could do with a little bit more pressure. So if you keep your eye on things like that or whoever's doing it, that's really important. The most important thing I can tell you though is please make sure that the person who is doing this doesn't have a vendetta against you, because they could really pump it hard and it'll be really uncomfortable. So just nice and easy. So let them know they don't need to do a full pump, because often you don't need to. Just start off really slow with a gentle squeeze and just see what happens and how high the skin and that layer of muscle ride up into the cup. And you'll give them a gauge, oh, yep, that's too tight, and they can just release it a little bit with pulling the little yellow valve upwards. Really, really important. These valves were the bane of our existence. We had to research hard to find out how to get a valve that worked to prevent the leakage of air. So many of the testing protocols that we did were just useless, I have to be honest. And the supplier that we've got has developed a double D valve which prevents leakage. We are wrapped. These things are great, really good. That's the two things you've got to look for in a cupping set, is to make sure that your valve is secure, because so many of them just allow leakage and you put them on and 10 seconds later they've released the air again, and to make sure that the plastic is firm and doesn't crack, because if it cracks again the air leaks out and then you've got that issue where you've got no suction. All right, babe, well, I'm going to show these folks how to take these off. In some circumstances, a lot of skin and soft tissue goes into the cup. In those cases, sometimes you've really got to ply the skin out to get it out, and just releasing the valve isn't enough. Other times you release the valve and they just lift straight off, all right? So I can already see, and I don't know whether the cameras can pick up on that, it might when I take these off, that the amount of blood stagnation that's going on in the top left area here for M is very different than what's going on in the right. Keep in mind that cup, I didn't put that cup on effectively at the very beginning and it came off, so this one's been on for a little bit longer and I have increased the pressure, but this one is purple. Super good. So I'm just going to release, because there's quite a significant amount of skin in that area and it's still got a bit of pressure, so I hold the skin Peel on a 45-degree angle. Normally I would wipe, but I don't have them here with me. And then we'll have the skin pull out nice and easily. I always work my way back to the beginning, so I put the cups on top to bottom when I'm doing this particular area, but regardless of where you're doing your cups, the one that you put on first generally is the one that you take off first. Makes logical sense here because it's already been on for longer. Pop the valve, hold the skin and pull off on a 45-degree angle. Nice. Not sure why it's always Em that gets the treatments, just saying, feeling a little bit ripped off.
I'll do one on you.
Excellent. Nice. Em's got some really interesting results on her cupping today. One I wish you could see, but I suspect that the angle of the camera means that you can't. Em's got some blanching of her skin, so little petechia we call them, where there's like little tiny blood vessels in there that have released. Generally speaking, we tend to get an overall colour change in that area so that we know that we've had the cup on. It's nice and even. Looking good, babe. You're going to be feeling great after this.
Awesome. Oh, I love that release.
That release feeling when they come off is incredible. Remember, when you first get the cups on, that first minute or so is pretty intense as those adhesions are starting to break down. And then after that, yes, it does still feel like a bit of pressure, but it feels like it's released significantly. Did you dribble?
I think I dribbled.
Feel free to dribble.
Oh, this just feels so good. I did nod off for a second.
It's taking them off that feels incredible. You feel lighter and your ability to move. I normally get my patients to get up and have a good move straight away and they can feel it straight away. We're not going to let Emily do that because she's not got a top on and that would be awkward for the video. But make sure that you drink plenty of water.
Is she talking to me?
That was for you. After you do this, just like a massage session or a needling session, cupping causes toxin release. We need to get that out of your system. So drink water to assist that blood flow to go to your kidneys, bladder, and then you can get rid of it at a later stage. And of course, once you've done this, if you need to get rid of the oil, there's not a huge amount of oil on when you do the technique that I used of putting it on your fingers and rolling it on the actual cups themselves. If you're going to squirt the oil onto your hands, rub it onto the body, make sure you get rid of that because otherwise you'll end up with it all over your clothes, which isn't fantastic. So you get a warm washer, rub that off, fantastic. And then don't forget to apply your Chirofix over the top of your cupping kisses, which again expedites any type of healing that you're trying to achieve in that area of your body, whether it be your shoulder, your back, anywhere that you're trying to treat. Make sure you treat with Chirofix to be able to assist that healing process. Hopefully you've enjoyed your cupping session. That's how you do it on the spine, and we'll be coming to you with heaps of videos, lots and lots and lots of different places that you can get the most out of your cupping set. Thanks for having us on your therapeutic journey.